Pleased to welcome Assemblywoman Valerie Vainieri Huttle, Assembly Deputy Speaker. Good to see you.
Thank you, Stephen. Always nice to be here.
We talk about so many important things, but I want to get right to an issue that doesn't get talked about. Government-sanctioned safe injection sites for people who have drug issues.
Yeah. And what they actually are overdose prevention centers. You know, as you know, we have a opioid crisis in this country. And in New Jersey, 8 people die a day on overdosing. And most of these are young kids. They die in the shadows. They die in the alleyways. This center, or these centers, are medically supervised. And if you think about it, and you remember back in the 90s, during the AIDS crisis, the clean needle exchange was a radical idea, correct?
That's right.
And it has been working. These overdose prevention centers are working around the country. They're working in Canada. They have,
around the country?
Well, I should say around the world.
Yeah, because
Canada, England, Sweden.
Do we have one in the United States?
We do not.
Not a single one?
Not a single one. They have tried in Philadelphia. They have tried in Boston. They have tried in New York City.
What has stopped it?
But last month, we had some good news.
With the judge's ruling?
Right. Judge's ruling said it did not violate the Substance Controlled Act. So therefore, that's a step in the right direction, because I think the naysayers were like, well, they're coming in and they're doing drugs. Well, guess what? They're doing drugs anyway. And if we can prevent one death, if we can prevent an overdose death, then you know what? We're helping. And we have done so many things in New Jersey. I mean, we had the Opioid Prevention Act, which now allows Good Samaritans to call and not have any fear.
Right.
We have now new warning labels on painkillers and opioid drugs that it can be addicted and you can suffer an overdose.
We're making changes.
We are.
But this
Small steps. This is radical.
But this has been around, this idea is not new. You are advocating it. Are you getting significant opposition from your colleagues in the state legislature?
Well, this is the good news. It's bipartisan. I have Republican sponsors on the Assembly side, and of course we have, I don't know if we have Republican sponsors on the Senate side yet, but let's face it, the opioid crisis touches everyone. It transcends politics. I don't care if you're a Democrat or Republican.
Urban, suburban, rural.
We are in a crisis, and we are trying to do more. The former Commissioner of Health, Sharif.
Sharif Hall was actually in here today. Go ahead.
He was actually, he said it's a great idea. The intent is there. We just have to figure out how to do it legally.
Where's Governor Murphy on this?
I don't know yet, but I'm hoping that during the lame duck, at least we can get it on the Health Committee. We can discuss it, and then we can see where we're going. I don't know. I would find it hard to find anyone that if you can save lives and you could prevent overdoses, and if someone is going in to inject, think about it, and they're going in with medically trained staff and support services, that it could happen just one time. They may be able to be counseled. They may be able to get help. In the interim, if they're shooting now in the alleyways, there's no help for them. There's no service for them. This is supervised, sanctioned injection sites that are safe.
Assemblywoman Valerie Vainieri Huttle, Deputy Assembly Speaker, let me ask you something. When did you introduce this idea?
Last year.
So it's been a year or so.
But we have been talking about harm reduction centers. There has been discussion, there has been conversation, so all is not lost. You know, due to scheduling, we haven't been back to session for a few months. So I am hoping that when we do go back, it has, you know, it's a priority.
I'm sorry for interrupting.
Yeah,
I'm curious about this. I appreciate the fact that you're trying to do this on the state level. We'll see where the Commissioner of Health is on this. We'll bring in Commissioner Persicelli.
Our new commissioner, acting commissioner, I believe.
Yes. We'll interview the governor and ask him about this.
Great.
Why is this not a national initiative?
You know, it is a national issue because I would tell you that the National Health Center has created grants
The Centers for Disease Control?
Yes.
The CDC?
Close to $1 billion, $956 million, I believe. And that's in research. I mean, we have all sorts of problems with opioid overdoses, and we have children being born addicted. So it's geared for research and where they can be assisted through new medications. You know, we just had last month, I think it was, or 2 months ago, some of the independent pharmacies took part in giving out free Narcan. And in my neighborhood alone in Englewood, whatever was given to them, allotted to them, done, completed. I mean, so the Department of Health here in New Jersey, we're taking steps, again, with some of the laws that are being created. Now you can go and get medically assisted treatment without a doctor's prescription. Think about the people that are on Medicaid. They're not seeing doctors for, being addicted. So we have taken steps. But if they're going to inject, let them inject in a safe place.
And by the way, just to clarify, what we're talking about is a judge's decision. There was a judge's decision that basically ruled that the proposed site in Philadelphia,
Right.
Philadelphia is attempting to do this.
That's right.
That the proposed site in Philadelphia to do just this
Right.
does not violate federal law. Other cities, including Boston, Seattle, San Francisco, New York, have also considered doing this.
And
New Jersey would be with these others.
I'm hoping we're the first state. I mean, look, we've done some pretty progressive things in the state. And I'm hoping that we can, and I'm hoping, again, with the help from the National Health Centers, from almost $1 billion for research, that the statistics prove. Look at the statistics alone. It's not my idea. Statistics prove not one death.
Assemblywoman, I want to thank you for joining us. I
Thank
promise
you.
you we'll continue to monitor this issue because it is literally an issue
Crisis.
of life and death.
Absolutely. Yeah.
This has been State of Affairs. I'm Steve Adubato. Thanks for watching. We'll see you next time.
State of Affairs with Steve Adubato is a production of the CAUCUS Educational Corporation. Funding has been provided by Holy Name Medical Center, NJIT, the law firm of Gibbons, P.C., New Jersey Resources, Fedway Associates, MD Advantage Insurance Company of New Jersey, the Fidelco Group, and by these public-spirited organizations, individuals, and associations committed to informing New Jersey citizens about the important issues facing the Garden State, and by Employers Association of New Jersey. Promotional support provided by AM 970 The Answer, and by Commerce and Industry Association of New Jersey.